So first starting with measles again. So the next state or the newest state to report a cluster of cases is North Dakota. And this is going to be the story of the year and maybe forever now as measles establishes endemicity. And the thing is that we've got a solution here. It's the vaccine. It's not anything that is very difficult to contemplate. But what we see is that there is purposeful confusion respecting this with respect to this vaccine, that they are trying to, and by they I mean the anti-vaccine movement, are trying to confuse the issue, confuse the general public. And this is where the role of infectious disease physicians, so IDSA recently put something out on their blog, Science Speaks, talking about this is the role of ID physicians to explicate this, to unravel all of this confusion that's being sowed by the federal government. And I think when the new New York City Health Department commissioner said that this is purposeful confusion, I think that's an accurate way to describe that. So COVID. COVID continues to be something that we're studying a lot, trying to understand more of, and more data is coming out to understand who is going to get very sick from COVID. And there are now biomarkers actually related to kidney function that might hold some idea or give you some idea of who is going to get into trouble with COVID. We kind of know it broadly. If you're older, have high risk conditions, immunocompromised, obese, pregnant, but you can even get even more precise by looking at biomarkers. And eventually we will probably get to biomarker panels that are done on many infectious diseases to understand who is at risk for severe disease. A couple of other things on COVID recently came out as well. One is that we know that during COVID, when people were staying at home, child abuse notifications went down, but it seems that they came back up and actually increasing admissions to the intensive care unit for child abuse after some of the early disruption happening from COVID, which I think is part of why when you're thinking about pandemics, you can't just look at the short term, you have to look at the long term, and you have to look at the cascading impact, not just on the disease of concern, but on all health issues such as child abuse. We also saw the number of stimulants that are prescribed for conditions like ADHD go up significantly during COVID. Maybe that's because ADHD became more diagnosed, or it could be that it was something that people were needing and prescriptions became easier to get because people were doing it via telemedicine, whatever it would be. But the point is that a pandemic doesn't just involve one disease process. It's driven by one disease process, but it impacts all aspects of life and certainly all aspects of healthcare. One of the other things that came out of the pandemic was, stay at home if you're sick. But there's the opposite, called presentism. People who would show up when they were sick and not only be less productive, but also potentially spread the disease or spread COVID or whatever it might be, influenza, RSV, in their workplace. It turns out that people who subscribe to presentism, who show up sick, are more likely to have absenteeism later. So it may be that this really it's a wash, that if you show up for work now, today, when you're sick, you're probably going to call off in a couple of days anyway. So you kind of lose the whole the benefit that you might think you're getting from being present. HPV, that vaccine is probably one of the most game-changing vaccines because it prevents multiple different types of cancers, most important of which is cervical cancer. There's a big campaign now being rolled out in India, which is a place where a lot more HPV occurs, and HPV-related disease like cervical cancer. There's a very big burden there, so there is a major impact that could occur with the rollout of vaccines like Gardasil in India. So I'm going to kind of jump around and talk about a couple of other interesting stories. So people's eyes, many people didn't recognize that bacteria normally live there. And sometimes people get corneal abrasions, meaning that area of the eye gets scratched and it needs to heal. There is work being done here in Pittsburgh to engineer the bacteria that lives there, which is a type of cornybacteria, to produce certain anti-inflammatory molecules that may allow corneal abrasions to heal faster. So that's really cool genetic engineering work. I have to jump back to COVID. I should have said this earlier, but there was an interesting story about formula in breast milk that came out, that certain companies were trying to, especially in Mexico, cast aspersions on breast milk, saying that the formula fed or the formula feeds would have immune stimulating properties, would be safer, And I think there's not much data to support that breastfeeding was not a major route of transmission for COVID, and breastfeeding is important for a whole host of reasons to children. And so there is some pushback in Mexico against some of these companies that made formula about using what I would call false advertising types of techniques regarding their formula. Antibiotic side effects. So we want to make sure we're using antibiotics judiciously. An interesting side effect is panic attacks. It happened with certain antibiotics of the fluoroquinolone class. So the fluoroquinolone class includes Cipro, and Cipro is the biggest offender there. We've always known that Cipro, levofloxacin, or Levaquin, they can cause side effects that involve mental status. But panic attack seems to be one, and seems to be more common with Cipro. So again, you shouldn't be taking antibiotics if you don't need it. And speaking of antibiotics, basically we've seen, and I've talked about this before, major pharma companies pulling out of antibiotics because they're not very lucrative. So in the last 5 years, we've seen 35% decrease by large pharma in antibiotics, which tells you that they're not interested in it because it's not a great market. It has altered market forces because, as we talked about in other videos, the revenue that they get is coupled to the volume, and you cannot overuse antibiotics because there's negative consequences. So we need to really change the game there. And that's where the Pasteur Act, which is a Netflix model where you can subscribe to a healthcare system can subscribe to an antibiotic portfolio and use them as much as they need to with a single fee, and it decouples revenue from volume. And that's what we need to do, and they do that in the United Kingdom. Dual use research of concern. So that's when you do experiments that might enhance the transmissibility, the antibiotic resistance or antiviral resistance, or you change the properties of a pathogen in order to study it, to understand how that might happen. This has been controversial with bird flu. It's been controversial with COVID and other coronaviruses. The Government Accounting Organization, or the GAO, basically has put out a new report calling for more transparency in how the government deals with this, what they deem as dual-use research of concern, what they want to fund, what they don't want to fund. And I think in general, more transparency on this nebulous issue makes a lot of sense. If you're going to be doing this type of research, it needs to be done transparently. People have to have confidence in it. And most importantly, it has to be done with the appropriate level of biosafety. HIV. So people who are HIV positive, they have functional decline versus people who are HIV negative. Even when they're on antiretroviral, they don't do as well. And there's a lot of effort now to figure out how do you prevent that functional decline so that they're able to maintain their activities of daily living. New studies showing lots of different types of exercise, like high intensity, that all makes sense. Any type of exercise is going to prevent that functional decline in HIV. Respiratory viruses, one of my favorite topics. So we talk about this whole swarm, about a dozen of respiratory viruses that range from flu to COVID to RSV to metapneumovirus to parainfluenza to adenovirus. Can you tell them apart? Can you tell them apart even in immunocompromised people where they have more severe manifestations? You cannot tell them apart clinically. New studies shows that there's not much way to do that. There's no way to do that. It's basically just guesswork. So when someone says, oh, that looks a little bit more like RSV or metapneumovirus, it's probably not actually accurate. You need to do testing to distinguish these respiratory viruses. One more on precision medicine. So septic shock, the end stage of many infectious diseases, where you're in sepsis, where you've got immune dysregulation, your immune system is haywire from an infection, and now you're unable to maintain your blood pressure and you're having multiple organs fail. What are the risk factors for septic shock? Some of the biggest are very not surprising comorbid conditions like liver cirrhosis, like having a malignancy, like having kidney disorders, or having your kidney impaired by the infection. So there are ways that you can tell whose septic shock is more likely to progress, whose septic shock is more likely to be fatal. And this again goes back to this idea of precision medicine, that not everybody fits into the same box, and there are ways to kind of pull people apart to distinguish them. The last thing I wanted to mention is something called lungworm. So this is an infection that comes from rats. It is a worm, and there are reports that it's now endemic in many different countries. We often hear about it in Hawaii, but now there are certain animals like a wallaby in California that was infected naturally in the environment there. This is going to not pose a major risk to humans, but it's going to garner headlines. It's already garnered headlines, and humans can get infected with the lungworm, which can migrate through their body and cause severe disease. But this is not necessarily a major concern, but the lungworm has kind of taken up residence in parts of North America, which is not surprising. But it's mostly a travel medicine oddity that you would see in people that went to Hawaii. But watch for that in the headlines.